So let's go to the case study. So this is something that I want you guys to discuss as a group. If there are other people on this rotation with you, you guys should be going through this together. This will involve reading a case study, answering poll questions, which the links are in the slides, before going on to the next. So don't jump forward. It's okay if you don't know the answers to everything. This is, a exercise in, brainstorming and trying to think outside the box. And the case should be familiar to you because most of you guys are heard it during intern orientation, but let's take it one step at a time, okay? So the case that we're starting with is a patient who has asthma, obesity, academic failure. For this particular exercise, we want you to really focus on the asthma part of it, but going back later and trying to link some of these things together, you can always focus on the other two problems. So at this point, I'll read the case. If you'd rather read the case by yourself, go ahead, click on the case and read it yourself. You don't need me reading it to you. But, and then after you guys read the case, I want you to go through these questions and go ahead and click on the survey and answer the questions that are linked to the survey. So let's go through the case. This is the chief complaint is asthma. It was well child checked, but we changed it to asthma. The HPI is a 13-year-old African-American female who presents to the clinic for a hospital discharge follow-up. She was recently admitted for an acute asthma exacerbation. This was her third admission in the past 6 months. Her status improved rapidly after admission. She was discharged the following day on oral steroids and her home medications. Since going home, she's continued to need the albuterol every 3 to 4 hours. She wakes up every night coughing. Past medical history, she was born 5 weeks early, hospitalized at 8 weeks for RSV infection. Frequent URIs during infancy attributed to daycare attendance. Diagnosed with asthma 6 months ago after being admitted for respiratory distress. She has never been intubated or required PICU admission. ADHD previously seen at the USED, non-compliant with medication and lost to follow-up. Past surgical history, none. Social history, lives with biological mother and siblings. Father is incarcerated. No one in the household smokes, but neighbors smoke. Lives in an apartment in South LA. Heads, denies any alcohol, tobacco, narcotic use, denies sexual activity, failing 8th grade. Family history, no history of asthma. Parent with history of substance abuse. Meds, oral prednisone, Flovent, BID, montelukast, albuterol, taking as prescribed, non-compliant with ADHD medicine. Immunization, due for flu shot, review of systems, frequent cough, all other systems negative, and this is not a trick, it's just so we can get through this quicker. Physical exam is unremarkable. Assessment, moderate persistent asthma, which is uncontrolled with an acute exacerbation. Continue current medications, refer to allergy. So because we're focusing on the asthma, we'll stop there. I want you to go ahead and click on the poll questions, write down, summarize the pertinent risk factors for asthma. And then I want you to write down what questions you have that might help you better understand the situation. And then, what is the root cause of this patient's problem? Why is their asthma uncontrolled at this point? Be sure that you use your full name and submit your response before continuing. And it's okay that you don't know for sure what the root cause is. I just want you to brainstorm. So it's okay to include a couple of different thoughts. Maybe a differential would be just fine. And then you can press pause until you finish that, and then we'll continue after. So next section will be structural factors.